the other effects apart from the heart will be on the lungs, alright? And we call this respiratory because it involves breathing, and they actually cause quite a few, I would say, diseases like emphysema, bronchitis. It makes asthma worse. It causes chronic airway obstruction, which makes all actually presents with more and more difficulty in breathing as they grow older and older, and especially so if they keep on smoking more and more cigarettes. And apart from the lungs, then we go to the brain. Alright. How does it affect the brain? Is basically they also cause, like I said earlier on, it causes narrowing of the blood vessels of the heart. It also causes narrowing of the blood vessels in the brain, causing people to have dementia. That means they get a bit more, they're not that normal. They also can, as the blockages gets worse, they may end up having a stroke. Now, continuing on the same story of blockages of the arteries, because smoking actually affects the arteries by causing it to get blocked, and it affects all over the body. As mentioned earlier, the heart, the brain. It also affects arteries in your legs and hands. Right. So as the arteries in the legs get blocked, there is a condition where you call it ischemia. Ischemia means there's lack of oxygen and blood flow to the legs, the muscles in the legs, and hence you get pain. And over time, when there's more and more blockages, the blood supply to the skin becomes affected and becomes gangrenous. And if this condition carries on, the person may have to have his leg amputated, cut off. Right? Now, the other effects of cigarette smoking also affects those who decide to live an active life, because it reduces their ability to exercise, because it affects the heart, it affects the lungs, it affects the arteries, and hence the ability to live an active life becomes very badly affected. Okay.
Is lung cancer the only cancer caused by smoking?
Now, lung cancer has been shown in many studies to be mainly caused by cigarette smoking, both in males and females. But the lung is not the only area where cigarette smoke has been shown to be related to cancer. The other areas the other organs that are affected and shown to be, I would say, caused by smoking will be the mouth, because the cigarette is always in contact with the mouth, and the throat, because the smoke goes through the throat before going into the lungs, and as it passes down, it also affects the esophagus, the tube where the food goes down into the stomach. So stomach, throat, esophagus, stomach are also, cancers are also known to be caused by cigarette smoke. And actually, because it affects the whole body, the effects of the smoking, the compounds get, I would say, gets into the bloodstream. So even organs further from the lungs are also affected, like the bladder, and in women, the cervix. So smoking does cause many cancers in the body.
What is secondhand smoking?
Secondhand smoke usually refers to the people who actually do not smoke but are in the environment where there are smokers, and hence you get the effects of the smoke from the cigarette of someone smoking, and also from the exhaled smoke from the person. Now it has been shown that it affects the children much more than adults, and children who are exposed to secondhand smoke, especially in enclosed environment like in a car with all the windows up and with the aircon on, or in a restaurant, that children actually suffer more respiratory higher asthma, rate of asthma. They have, if they get flu, I would say worse off than normal people, to the extent that there is a higher incidence of them requiring intensive care admission. So secondhand smoke actually does cause more danger to the people around the smokers.
The last question. Why do people get addicted to smoking?
Alright, this is mainly because of the compound called nicotine in the smoke, in the cigarette smoke. As someone inhales the cigarette smoke, the nicotine gets into the bloodstream very quickly, usually less than 10 seconds. It goes to the brain, it makes them feel relaxed, it makes them feel alert, it gives them a high feeling. But this effect goes off quite quickly, and to get this same effect, the smoker have to keep on puffing on the cigarette to get more and more of the nicotine. And hence, they become psychologically dependent and also physically dependent on the nicotine. That's why cigarette smokers keep on smoking many cigarettes to get the same effect of the nicotine, to get the high effect, to get the calming effect. But since they only last a short while, they have to keep smoking and smoking and smoking, and hence this becomes addictive.
It's a nice pleasure interviewing you, Dr. Chua. Thank you.
Thank you very much for having me on this short discussion. But I think it is very important that this message goes to all young children not to try smoking. I've not smoked at all since I was born, and I've seen, as a doctor, I've seen many dangers of smoking, and I hope everyone gets the message that smoking is very dangerous.